Dr. Matt will just sort out his volume issue, but we can crack on. So welcome everybody to Apex's launching a successful longevity clinic seminar. And my name is Dr. Alice, and Dr. Matt will be joining us shortly when he's sorted out his sound issues. But I want to give a really, really warm welcome because we've got a really special guest today, who is Samantha. So hello, Samantha Evi-Parker. Very, very nice to have you tonight on the show, if you like. Can you, if you don't mind, introducing yourself and just telling us a little bit about yourself, your background? I will just say very quickly, Samantha is one of our alumni students. She's done incredibly well since she did the course, which was only in September, and she's already managed to put so much stuff into practice. So we'd love to hear everything from you, Samantha. So yeah, over to you. Tell us a little bit about yourself and what got you into longevity.
Okay, so I'm Samantha Evi-Parker, and I am a nurse by background. 13 years nursing, worked in inner city A&Es in London, and I'm now in the South Coast in Hampshire. I left the emergency care, I suppose burnout in a sense, and basically launched my aesthetic clinic. And I've been full-time within aesthetics for about 18 months. And at that time, I have joined the Apex medical team, completed the course August, and had the in-person day in September, which was like, it was such a whirlwind that day. And so yeah, since then I've just started seeing menopause clients and some weight loss patients.
Amazing.
Really great to have you here, Samantha. I'm just going to check my audio is working now. Can you hear me? Fantastic. Okay. Yeah. Brilliant. It's always good to have technical issues on the night, but no, Samantha, it really is a pleasure to have you here. And I don't know if Dr. Alice mentioned this while I was offline sorting things out, but Samantha has actually been shortlisted for an award with the Menopause in Aesthetics company, just due to how well she has done this year in terms of getting herself stuck into longevity medicine, stuck into menopause care. So really, really well done to you, Samantha. And she's being very modest here about her achievements, but she really has been an incredible contribution to the Apex medical community. She's always on the boards and the forums, helping new people who are starting their courses really get into longevity medicine. So it's been really, really great to have you here, Samantha. So tell us, Samantha, you tell us a bit more about your journey. Let's get into it. So obviously you started off you originally as a nurse, emergency care, wasn't it? And then you've gone into aesthetics, purely aesthetics for a couple of years, and then you wanted to add longevity medicine into your practice. Now, how did that work for you? Like, how did you sort of think, right, I've got an aesthetics practice, I want to add longevity? I guess why is the first question I want to ask. And then second question is, how did you actually make that transition to start offering these services to your patients?
I mean, the easiest thing for me was the fact that whenever I would see my patients, my clients within aesthetics, you would always start off with, hey, how you doing? And as a nurse, as a clinician, we tend to read between the lines. And I spent a lot of this time reading between the lines with a lot of my patients and noticing that the care, or rather the longevity care and the functional health and the hormone care was completely missing, especially the access they could get to within the NHS and with their GPs. So it really started off as that for about a year. And then I did go to some menopause conferences and just thought, okay, if I were to just really build up my own knowledge, then when I see my patients, I can just sort of support them that way. I can signpost them, I can give them, the necessary, I suppose, armory when they go see their GP to get the help that they needed. And when I noticed that wasn't helping and that wasn't working, and they were still coming back to me, and I'm literally injecting Botox and they're crying, I thought, you know what, I can do something. I 100% can do something. And if it's not going to be you, then it has to be me. And I know we should apply that thinking in a lot of things that we do in life. If you're not going to do it and you see a problem, then I'm going to do it. So at first I started looking at courses. So the BMS, they've got a course, and that was completely oversubscribed. Looked at some uni courses, and I think the problem that a lot of NHS produced doctors, nurses, clinicians, etc., is that everything, we have to work hard for it. Like, it has to be hard. Like, we have to graph at uni, we have to really study, we have to do lots of papers, we have to, you know, have lots of I don't know, like residency before we have the ability to take on a new field. And so I went with that mindset and was like, okay, great. Guys, I really want to give you menopause care, but it's going to take me. And and I think I spoke to like a non-medic, and she was just like, why? That doesn't make sense. Like, and I'm like, but that's how it's done in the NHS. And she's like, but you're not in the NHS. And so I don't know how I saw your ad or your post, and I emailed you, Matt, back and forth. And I think I just was really able to air a lot of my concerns. And yeah, so basically did the course in August, finished it, got my certification, and I just went, you know what? Now, I'm gonna do it now. And that was it, yeah.
Amazing.
Thank you.
Matthew.
We always talk about when you're on the course, and I know we talked about this, Samantha, is that what you want to do is you just want to line up those first 5 patients, and those first 5 people that are going to come and see you to get that advice, because it's just the same in aesthetics. And when you're learning aesthetics, is that you don't know how to start, and it's kind of one of those things, you just have to start. The first time you sort of get out there, you're going to feel a bit nervous, you're going to feel a bit anxious, but it's actually just really exciting to do that, learn it, and know that you've got the support, obviously, with Apex Medical here. And I know we've had lots of back and forth, Samantha, as you've sort of seen your first clients, your first patients, and we've actually talked and advised based on some of the protocols that you've been learning. And it's really amazing to see you grow, and now seeing you pass on that same advice to people who are coming through on the courses now. But Samantha, it's really great to have you here. And I realize we've glossed over introducing Dr. Alice as well. So I wanted to just take a moment to introduce Dr. Alice. So Dr. Alice is a co-trainer with Apex Medical, and she's also the founder of OneLife Clinic in Harley Street, which is a longevity medicine clinic. Now, Alice, you're ophthalmologist by background, and you now do that sort of part-time, and you do more sort of longevity side in terms of your clinic with seeing patients. So tell us a bit more about your journey into longevity.
Thank you. So yeah, hello everybody. I'm really excited to be here and with Apex, because I just think, as Samantha's saying, it's offering so much that a lot of us can do, and it's just getting our head in the right mindset, like you're saying. Take that Nike slogan, let's just do it, and just, you know, we can really help some people. So I guess in terms of my journey, it's a sort of personal one. I've always been into sports and health. My cousin was an Olympic athlete, so I saw like the discipline and everything that he had to put into his training, and I guess in my family we were just very health conscious, and I just had that as a background. And then going through life, I would just see that everybody wasn't the same as that, and actually, you know, I felt that I had more energy and stuff than other people. I know that sounds a bit crazy, but I felt I had more energy and I could do more stuff. And actually, it's the stuff I'd learned along this journey I could really use to help people. So then going into medicine, I was a medical registrar in endocrine medicine, which again, I really enjoyed. It was a very busy lifestyle. I loved the job, but I just hated the shift work. And I think that's quite common among a lot of people. For me, it was the nights. I just like sleep. I've learned so much about sleep, and I just knew how important it was. And I just hated going on night shifts all the time. I even like, when I say I like sleep, I got a bit obsessed with sleep, and I've even done some time at the Surrey Sleep Centre, like really looking into why we sleep, how we sleep, what goes on in our brains when we're asleep. Because I just sort of felt a bit shortchanged at medical school, when you spend about, I don't know, 1 lecture an hour on sleep, yet we spend a third of our lives asleep, and it's so important for us. So yeah, the lifestyle for me decided I had to change. So then I went into ophthalmology, which some people think is quite niche, but actually it's kind of the whole body, because it's the only place you can look inside the body, see nerves, see blood vessels in real life, see pathology without having to, you know, touch a finger on the patient. And I sort of saw this stuff going on, especially at the diabetic retinopathy clinics. And I was like, wow, you know, I can see inside how these blood vessels are just almost rotting away. And that's just in the eyes. It's going to be in the rest of the body. We've got to do something to help these people, because often they have no idea. They don't have any sight loss. They can't realize that until it's a bit too late. So I was like, we've really got to get into this. So that's when I sort of started looking a bit more about this preventative medicine, longevity medicine, whatever you wanted to call it at the time. This was probably about 4 or 5 years ago. And again, I'd agree with Samantha that there wasn't that much training or official training out there. And I kind of thought, oh, we have to do it officially. But again, like just networking, meeting people along the way, also just seeing friends and family that I'd kind of helped anyway with medical preventative knowledge that I'd gained along my journey. I realized that actually, you know, we can really, really help people with this. I think we're on to something. And that's when I mean, it just sort of blew up. I just started seeing a few people, and then that expanded, and then, you know, it turned into a clinic. So I guess as well, it was at a time.
That's a really key point, isn't it, Alistair? We all start out with those sort of few patients and those few clients. They tend to be friends and family. And Sam, you might have noticed this as well, that you see these sort of friends and family, and they're like, oh, well, I know someone. Let me refer these people. And it's one of these things. You're at a party, or you're at a social gathering, and you're talking to people, and people are really interested in it, and people want to talk more about it. And I think, you know, injectables is sometimes a little bit polarizing, but almost everyone wants to get healthier. So it really is sort of a really big topic to talk about. Now, look, I want to spend the next sort of 5-10 minutes really getting an idea about how the patient journey works in both of your clinics. So really talking about how the patient comes in, so how they originally get referred to, how you advertise, how you're sort of getting your awareness to them, how they're actually coming in for be a blood test or an intake form, how they have the consultation, and then what you do with your follow-up. Like, how are you following them up, and what's that journey look like? So I want to spend the next bit of time really focusing on that, because I think our viewers would really like to see how can they actually start seeing these patients, how can they incorporate that into their clinic. And guys, while we're doing this, if you want to just put into the chat, you know, what your background is, if you've got any questions about this as we go along. We've already got a lot of questions that have come in before the webinar that we're going to make sure we hit after we've talked through the patient journey. But I think that patient journey is the key thing to understand, from that moment of just advertising all the way through to that follow-up and sort of really providing that supportive care. So Sam, let's start with you. Let's talk through how you do that in your clinic.
It's kind of funny, because when I first started the course with Apex, I literally had 2 people in mind. And it's almost like I went into the course specifically for these people. I was like, right, I'm going to sort you guys out. And yes, I'm going to make a business out of it, but actually it came from a huge place of passion and integrity for these 2 people. And then one of them got pregnant. So I was like, oh, screw that. But the other person, I have been able to help her. And just from helping her, she has basically spread the word out, and it literally kind of cascaded from there. I think the difficulty that I have, and probably a lot of clinicians, especially within the aesthetic world, is that, you know, you can't advertise prescription medication. Where so for me to advertise my menopause care or my menopause support, it really is just putting up posts to have a conversation, or putting up posts to raise awareness, or I'll jump on my stories and I'll just talk about maybe someone who contacted me. I definitely did put this right away on my website, just hormone consultations, and just putting it on my socials, and people would kind of click through, and they would do like a 15-minute consultation call. But I found that I was spending like 45 minutes on the free discovery call. So there are lots of things that I've had to sort of tweak along the way. So, you know, sending them the pre-questionnaire that we got from the course, that really helped. So when the consultation calls came through for the free 15 minutes, it was really, I've seen your symptoms, I know what you're going through. Let me tell you how I can help you, and if this is something you want to do. That was basically how I started off. I definitely did have a clientele and have an audience from being within the aesthetic world. And the people and the women that I serve are of that age. So from 38 to, 60, 65. So the client acquisition, or at least how I started in the beginning, it was very organic. I think now that my passion is, realized, I'm starting to think, okay, this is not just I'm out here to help people. This is turning into like a business, which shouldn't be a surprise. But it kind of is. It's like I didn't jump on this because I was like, yeah, I'm going to make lots of money prescribing hormones. It really was, this woman is crying in front of me. I'm going to figure out how I can help you. So then I guess there were lots of other things I had to figure out. So it was like, getting blood tests, and am I doing cyclical blood tests? Am I not? What pharmacies am I signing up to? When we're doing the weight loss and doing the weight loss prescriptions, am I just giving them the standard dose and going through that ladder, or am I actually tailoring it to them? So there was a lot of that I had to figure out. And when I eventually did, because I would say that I probably only figured it out this month, it really is also the follow-up. So I've actually put together a WhatsApp group for my women, and I've just basically put them in there. I've asked them, hey, is this something you're open to? And just any sort of information that I come across, or any sort of new supplement or supplemental advice, I just kind of drop it in there. And I'm like, we're all sort of going through this together, and we're all living sort of in the same area. So if you do have any concerns, just put it in the WhatsApp group, because I'm sure if you're struggling with sleep and you're finding that, this drug is helping you, this other lady's going to really respond to that. So there's, the thing is that this is ever changing for me. Like, I've only been in this, 3 months. So it is ever changing. I have figured out my process by way of follow-ups. So I definitely am making sure everyone gets a 3-month follow-up. I am trying to make sure that even with the weight loss service, that people are getting blood tests, because I think with those people in particular, I really want to go into longevity with them rather than, hey, let's lose a couple of pounds. And also looking at how we can tweak and alter doses for them, because I don't think that just because you've been on the drug for 4 months, you need to be on 10 milligrams. I disagree. So there's just lots of things that I am learning, and it really is coming from a place of not just serving, but what feels right for me.
Brilliant. I mean, it's really nice to hear that, Sam, because I remember helping you with those first couple of patients that you were talking about, and I remember them. You've been mentioning them obviously anonymously on the group, and it's really good, amazing to hear that person's had such a good treatment. They've gone out and they've spread the word, and I certainly have noticed that myself. Is that the more you're treating patients, like I treated a retired plastic surgeon a few months ago, and he's had such a fantastic transformative experience with his different types of treatments that he now refers to every single patient he sees and every single clinician he sees. He sort of makes a recommendation of our clinic, which is fantastic. And are you doing lots of virtual consults or in-person consults? What's the mix there, Sam?
I think a lot of, see, the thing is, I can definitely manage this as a virtual clinic, especially because the blood test doesn't have to be done with me. I think one thing that I'm coming to realize is that obviously I'm starting as quite a small clinic. So it is, a party of one, that I am just sort of like, yeah, come in and I'll do your bloods. But, my catchment area can't be that wide. But I do know that with the blood company that you sort of recommended, I can actually send them to other clinics, get the blood test done, bring it over to me. So it's just about, I suppose, when I get that wider catchment area, letting them know, hey, you don't have to.
It's brilliant, because partnering with a testing company like that, and Randox is the one that we tend to use mostly, you can suddenly do consultations for anyone in the UK. And what's even more exciting is that we've actually just started offering consultations in Ireland, Switzerland, and the UAE from London, because we've actually started working out where the partners are in these various countries, and the fact that they accept a nurse or a doctor in the UK to issue these recommendations and requests for blood tests is fantastic. So you can actually really cross boundaries and set up this very broad, all-encompassing practice that has such a huge reach, far beyond what you can get in aesthetics. Obviously, in aesthetics, you also got that little local area where you're probably competing with 2 or 3 other aesthetics clinics. Having a really broad reach is really helping bring people into raising that awareness. Now, Alice, I know you have had consultations with people on the South Coast and in Ireland and in various other places. How do you find that sort of fits into your patient journey? How do you make sure they have their blood tests done? How do you make sure that they're getting the supplements and everything sorted?
Yeah, so I think it's amazing that you can do it online now. Very quickly, I would just say, like, when we started this out, we were doing everything in person because that's sort of what everybody wanted. They wanted that bespoke care. But then COVID happened, and actually everybody's so used to being online now that it sort of fits in with everyone's day-to-day lifestyle a bit more. You know, you can do the consult in the evening, your kids are in bed, they don't have to travel anywhere. Once you're done, you're ready to, you know, have dinner or whatever. So it makes it a little bit easier for everyone. And also then you're not having to pay so many overhead costs for a clinic room and stuff, which is quite good. But as I say, in terms of like managing people from afar, we have to be sensible. We have to make sure we do everything safely. So bloods are really important. But as Dr. Matt said, you can easily get that done with a third party. And we often use Randox. They have so many different clinics. In London, it's amazing. They have loads, and you could even go the same day and get the bloods done. Whereas further afield, for example, in Ireland, the wait is a little bit longer. It's a little bit busier because they're not as established. So I guess that's a slight limiting factor. However, I find it's worth just talking to your patients and really finding out what they're comfortable with. Because a lot of patients, they come to you because they are at that sort of crisis point. They're like, I need to make changes. You know, I don't feel well, I'm not sleeping, you know, everything is on top of them. And they want to just really see someone. And then if you're told, oh, the bloods are going to take a week, then it can be a bit disheartening. So a lot of the time I give them the option. I'm like, look, I can see you in the next 2 or 3 days. You can't have your bloods for a week or 2, but we can do the consultation based on symptoms, get the bloods done afterwards, and then if there's anything you're going to prescribe, then I'm happy to do that afterwards once we've got the bloods back. And I think that's safe. I think that's fair enough, as long as your patient is happy with that. Sometimes they're very fixated on a blood test. I know I get a lot of people that are really worried about their thyroid function, and also a lot of perimenopausal people that are worried. They want to know if they're in menopause medically and on a blood test. And so for those patients, I think it's worth having the bloods beforehand. But for a lot of other people, you can just get them done, you know, in a week or so after the consult, and then have a quick follow-up consultation, 5-10 minutes, go through them, and then just finalize that plan that you put together during your consultation.
That's great, and I think that's a really important thing. It's that order, isn't it? And we have an order that we teach in Apex about trying to get those blood tests first. But as you say, it's got to be what works for the patient, and sometimes actually just getting that initial consult actually helps you tailor those medications in terms of tailor those blood tests that you're going to do. Sam, do you tend to do your blood tests first or after your consultation?
I prefer doing them first. I've been doing them first. I have had a couple of weight loss clients who just didn't want to have blood tests done, or one of them had it done privately somewhere else, and you know, they get to have a look at that. But I prefer doing it first because I think for me starting out, I just really worry that, I mean, we know that HRT is safe. We got all the studies, we got the data, and especially if we're giving it in a safe way and for the right people. But I just sort of think, oh, what if I'm missing something? And maybe, so for example, I had a lady who came to see me, and she's 40, which is sort of the apex medical catchment age group. And I think, oh, I did speak to you about her thyroid. What was it? The
Remember, yeah.
Anyways, there was some autoimmune disorder that was kind of picked up in her thyroid. And for me, I was just like, oh, okay, what is this red number? And the thing is that she was fine to treat, but what I was able to do was I was able to now signpost her to an endocrinologist who was able to go, well, yeah, your thyroid's going to crash out at some point. Like, it's all right. Let's just carry on keeping and waiting. And I just thought, okay, fine. While she's waiting for whatever to happen with the specialist, she didn't have to keep suffering. And that was one thing that I was like, okay, great. I can cross that off.
Exactly. So we're getting some questions coming in, and I'm just sort of looking over here, and I can see them coming through on the chat, and I don't want to lose them. So I'm going to take those one by one here, and then we've got quite a lot of questions, which I wanted to sort of talk to you guys about different professions getting into longevity medicine, how to start doing it alongside aesthetics, CQC requirements, all of these things. These are all questions that have been submitted, and I want to talk to you guys about those. But first of all, I want to start with some questions that we've got coming in. So Anna Marie. Lovely to see you. Anna Marie is one of our previous students on the course as well, and I can see you're working with a dentist who is interested in starting a clinic with you, and you're quite apprehensive about the cost of various things. So how have you guys found that? How have you found the cost of ordering supplements and medications, and have you noticed that that's a relatively good business model to fit into your practice? Or Sam, over to you first.
Okay, so I think when it comes to cost, maybe if Anne-Marie has sort of like figured out her niche, really, I don't feel that within this longevity practice there is really any costs. I don't think, I mean, I'm a small aesthetics business, like I said, and for me, I didn't feel that there was any huge investment or any huge overhead that was stopping or restricting me from giving the care that I needed. So I'm going to say no, there isn't. And the thing that, that might be different, Anne-Marie, that you might find is that in aesthetics, we tend to keep stock, whereas because we are prescribing 4 patients per patient per their, assessment, there is no real sort of like stocking of supplements or keeping of anything. It really is just, sort of depending on the results that particular patient wants to achieve, it is on their dime. And you just need to be there to, what your investment is, your time, your knowledge, and
yeah. And are you the same, Alice? Do you sort of stock supplements? Do you tend to order them as needed?
Sorry. Yeah, I think there's like sort of 2 questions here. It's the overhead of just starting, and also the stock, if you like in aesthetics, you have to keep your supply of Botox or filler almost before the patient comes in so that you're ready to treat them on the day. In longevity medicine, it's not quite like that, because you're going to make the plan with the patient. I normally, send out that follow-up form to go through exactly what we talked about. I call it my pick and mix. So I give them a pick and mix at the end of the consult, which is all the options of every single thing that might help them on their journey. And then they can choose which ones they would like to invest in and which ones they're interested in. But obviously the pick and mix bar is open anytime if they want to come back and dabble. So it means, though, that you have a little bit of time to order the supplement, or, for example, I give out a lot of continuous blood glucose monitors. You have time to order that to the patient, so you kind of know if they're going to have it or not. So they're paying you back, if you see what I mean. So it's not out of your pocket as such. And then the other great thing about it is you can up price it. We can buy it for wholesale and then sell it a little bit more, just to give a little bit of an overhead to make the business work. And then if you have people that are, on the same supplements every single month and they want to order them from you, then you're getting that some passive income, which I guess is one of the really, good ways of making the clinic run, which you don't really have in aesthetics as much.
Amazing. Yeah, I think it's so key. And I think, Anne-Marie, hopefully that's answered your question and give you an idea that there's actually not a lot of upfront costs, because a lot of the things you're talking about, supplements, drugs, consulting, they're cost of sales that is referred to in the finance world. So it's essentially what you're going to be paying for when you're making a sale. So you're not paying for this unless you're actually consulting and bringing some money in. So you're not really putting a lot of upfront costs. So it's actually quite easy to start becoming profitable with longevity medicine quite early on, because if you're doing virtual consultations and you're just referring people for medications or supplements, and sometimes the markup, remember, can be quite high for some of these supplements and these medications. So when you buy things in wholesale, you don't necessarily need to stock, and then you sell that on to your patient at the RRP or even at a discounted price, you're still making some element of markup there as well. So you're gaining some money. Actually, the cost of ordering supplements and drugs, you actually tend to be making money when you're doing that. But Anna-Marie, I know you've got access to our community. So if you've got any more questions around that, just drop us a message in the community. I'm sure Sam, Alice, or I will be able to help you out further. Now let's go to a question from Rabia. Done a 3-day course with Derm Medical, fantastic training academy with our sister company, Training in Aesthetics. So you've haven't started working yet, but has phoned over 10 aesthetic clinics in Stoke, but no one's asked me to work with them. I don't know how to start work on my own, because I'm not even sure the price of treatments in Stoke. Now, this is seems to be a more focused question on aesthetics. Obviously, if you've got Rabia, if you want to find out more about longevity in terms of how to incorporate longevity, then that's something that we can talk about. But if you want a little bit more support, then I can certainly reach out to our colleagues in Derma Medical to reach out for you there. But do let us know if there is something more about longevity you want to talk about here. Now, Kirsty has asked about blood test companies. She's just looked at this and you can't find a clinic local to her. Now, have you guys ever come across that problem, Sam or Alice? You found you haven't got a clinic near a patient you're trying to have a consultation with? Yeah, no. Dr. Alice is nodding her head.
No, I think, once again, my patient group's quite small, so I've never really had that issue with finding a blood testing service than coming to me.
Yeah. And Alice, you were nodding your head. You had an issue with that before.
Most of the time, you can find someone that will do it. Occasionally not. Occasionally, sometimes the other thing is people have bloods done either on the NHS, or we've had some clients that have come from abroad and had their bloods done there and sent across their report. So I think as long as there are bloods, it's helpful. But time you can get them done. If in complete doubt, you can have them done on the NHS. But it obviously just takes a bit longer, and this is, people are probably not looking for that service if they're coming to you for a bespoke and wellness checkup. They want the results there now.
Exactly. Sam, we've lost your video, just to let you know. Oh, you're back again. So I just wanted to touch upon that as well, because there are other blood testing companies out there. If you're only in Hereford, so you're still in the UK. So the good thing about that is Randox actually offer some direct to consumer available kits that they can actually send out to them. They can actually do some tests and they can send them back. Now, they're not completely as exhaustive as some of the really comprehensive tests, but actually a lot of the tests that we teach on our courses are relatively cheap and easy to access, and most of those are available as home testing kits. So you can actually log into your Randox portal, you can order a home testing kit for your patient, that gets sent out to them, they do their test, the results still come back to you in the same way. So this is another really good option, particularly if you're based in the UK, or if you're seeing patients based in the UK and they're not able to make it to a clinic, and actually just sending them out a home testing kit, and you can test hormones, you can test vitamin levels, you can test various new things, even gut microbiome you can test at home in the patient's home. So there's a real range of things you can use there. So Kirsty, hopefully that answers your question in terms of what you can do regardless of where you are in the UK. Now Adam has asked, what's the standard lab work order? In fact, there's 2 people have asked what's the standard lab test that we require. So I mean, I'll start with that answer. That it's quite complex in my mind. There's lots of different requirements depending on what you're seeing. So at Apex Medical, we always teach those 5 steps of longevity, and that's all the way from diet and lifestyle, hormones, then through to weight optimization, performance, and then ultimately cellular aging. And you need to stack one on top of the other in order to achieve that apex of healthy aging. So the testing really does depend on the intake form that the patient fills out, what they're interested in, and then there's certain panels that I definitely want to check. So for example, I know that magnesium levels is low in most people and vitamin D levels are low in most people, so it's really good to see that, show that to the patients. They can see there's something they can correct immediately. Now, over to you, Sam. Tell me, do you have standard lab panels you order? Are you pretty sort of routine in terms of your lab work, or do you bespoke it based on the intake form?
I think, yes, definitely bespoke it to their intake form. And I think, like I said, I've sort of niched down by way of it being a hormone clinic. So I would be doing sort of like the fertility panel. That's what I've chosen. It covers my thyroid. It covers, you know, some vitamins and nutrients. It covers, you know, heart health, which I find very important when we're dealing with this, you know, bone calcium. So yeah, that I just sort of do that. And then if someone's coming in with, you know, like some really excessive symptoms, almost like, you know, the lethargy, the excessively tired, the fatigue, then I would just sort of go, let's add a bit more of a nutritional investigation to them.
I think so. It's good to be clear, isn't it, that obviously on the courses we talk about the protocols for managing these patients, and that doesn't just mean the supplement or the medication protocols. This means all the way through from what tests you should be ordering, how you can actually integrate with patient wearables and patient-led testing, the consultation and the structure, you have that, but then also going into the recommendations for either further blood tests, because sometimes you do need to check certain levels, or you need to recheck other levels to be able to prescribe testosterone, for example. And all of these things, these are all sort of laid out quite clearly, that you can see the protocols and the structures that you can just take and you can template into your own clinic. And then once you get into the position where Alice and Sam are, that you're seeing patients regularly, you can then start adapting that to, okay, well, this patient is coming in for more of an andropause consultation, but I want to also talk to them a bit more about performance. So let's get into some vitamin tests, let's get into some mineral tests and various other things that you can then incorporate into that consultation. So hopefully that answers your question, Adam, and the few others that asked about blood tests, so Yasmin as well. It does really vary, but there is relatively straightforward protocols that you can sort of copy and paste into your own clinics from the courses. Now, Julia has asked, is the prescription drop shipped to your patient? Well, certainly when I prescribe them, they essentially go straight to the patient. And hopefully you've been using the partners that we've recommended to you, Sam, that you can actually order online and it goes direct to the patient. Is that what you're using in your clinic?
So when I went to Menopause and Aesthetics, I went to one of your conferences last year, and I met with one of the partners, Roseway, and I know you've given me some other really good partners, especially if you're going to be doing the weight loss drug. But it literally is, you know, prescribe it online, send it to them, and then I'm done. You know, I put my instructions and I send my follow-up email, and then it's really up to them if they want to complete that order and follow the advice.
And there are pharmacies out there that actually charge the patient for you and then give you the difference between the wholesale price and the price that the patient pays, which is another little kickback that you sort of get from that sort of medication, and which can be quite large when you're thinking about some of the injectable injections and various things like that. So I think that's a really a really important thing to bear in mind. It is very, very straightforward to do this. So next question I'm going to take myself, just because I'm in the middle of filming our new course, and it's very relevant to the course that we are filming all week this week. And this is about whether or not you need to be a prescriber, that Kirsty has asked. And the key question is, obviously you need to be a prescriber to be able to prescribe things like testosterone and things like HRT. But there is a whole host of longevity, evidence-based supplements that you can incorporate into your practice, which work. They really, really work for patients. If they're taken in the right form, in the right dose, and at the right time, they actually really work as an alternate treatment. So just dropping in, for example, into andropause, there are supplements out there that will boost testosterone levels to the point that you still need to monitor the testosterone levels, because the testosterone can get high just from these supplements only. There are also supplements out there that will reduce sex hormone binding globulin levels. Now, SHBG is a really important molecule because it essentially takes away testosterone from having its action in the body. So if you can reduce those levels, you can even boost further the active testosterone that's available. Then there's even more. You can dive into the individual symptoms associated with andropause. So things like low libido, erectile dysfunction, issues with mood and memory. All of these things you can dive into individually and find supplements that independently work in these different areas. So there's so much you can do out there. And you don't need to be a prescriber to offer a lot of the range of longevity medicine therapeutics. So just wanted to jump in there and answer that one question. Dr. Alice, yes. You don't need to put your hand up.
I totally agree. Being at school. No, I totally agree. And I just wanted to add on, it's amazing when you start off, you think, obviously the course, I know someone's asked about what we cover on the course, and we can go into that in a minute, but we cover all these different topics, all these different options, what bloods to do, how to monitor them, how to, prescribe all these supplements. But you'll be amazed. And you think when you start out, I need to learn all of this because I won't be able to give them any knowledge. But actually, a lot of the consultation surprised me at the beginning that it's really to do with those lifestyle changes. Because if we don't crack the lifestyle changes, it's as if it's like the same as how, going on a sunbed every week and having Botox. Like, you might as well squirt the Botox out the window. You have to crack the lifestyle changes first, which are essentially free. And then you can move on to the supplements and the medication. So there's so much you can offer people, and you'll be so surprised how little knowledge people have sometimes when it comes to, especially things like diet and what's healthy to eat and everything. People's perception of things are all over the place. So there's so much you can do just from a lifestyle point of view without even prescribing. But then, as Matt says, there are lots of supplements you can give if you're not a prescriber, and will really help benefit people.
Exactly right. And it's just, it's such a broad reaching idea, this whole idea of longevity medicine. But if you go back to that pyramid, that structure, it really helps cement in your mind, right, how can I actually optimize this person? How can I bring in supplements and diet and lifestyle changes to optimize each of those 5 steps? Now I just want to get to the next. We've got a lot of questions coming in here, guys. It's great to see so many questions in, and we'll try and get to all of them in our allotted time. But anything I don't get to, we'll try and put our email address in at the bottom. In fact, if I can ask our team just to put the email address into the chat here, then if I don't get to anything, please do drop us a message and I can get back to you directly. I know we've also got a big bank of questions that people have submitted before the webinar. Now, I don't know if I'm going to be able to get to those. So if you have submitted a question before the webinar, please just drop them in the chat so I can prioritize the people who are here watching live. So this question is from Amy. Can you have more information on the course structure and the topics covered? Just to avoid my repeating myself, Alice, do you want to go through the sort of course structure and the things that we cover during these courses? That you're on mute, Alice.
Sorry. So yeah, there are 2 courses that at the moment available. There's the foundation course and the advanced course, and essentially when you buy that as a package, it's an e-learning course. So it's something crazy like 20 hours of e-learning, which FYI you can speed up to listen to on double speed, so you can get through it. But that covers all the science. It starts the pyramid of longevity, which Dr. Matt was talking about. So we start with the diet, sleep, substances, activity levels, and stress levels and stress management. Get a really good foundation in that. Once we've done that, we can then move on to the hormone optimization, thinking about menopause, andropause, and all the things we can do to investigate and manage that, both lifestyle and once we've done the hormones, then we move on to the weight loss management, and this is when we start to talk about the skinny jabs, Mounjaro, Ozempic, Wegovy, all those sort of things, as well as lifestyle changes and other supplements such as berberine, things like that. Once we've done weight management, then we move on to performance optimization, which is almost sort of like mental performance, so how to get people, really active, awake, alert, getting more out of their job, more out of their day. And then finally, we move on to the final as we were saying, no spending money and time on cellular aging products if you're, still drinking loads and not sleeping and you're eating a lot of sugar and things. So it all works sort of as this pyramid on top of each other till you get to the apex.
Thanks, Alice.
So when I came onto the course, like I said, I had a specific educational need, but it's actually incredible how the say the advanced course completely fed into massively with everything that I would sort of support with my menopause patients, everything that I would do with my weight loss patients, even, you know, the performance optimization and the sleep optimization. It's all just, to be honest with you, I think that this would probably make you a better, safer menopause specialist than it would be if you just went and did menopause course. So I did tell you this, Matt. I was like completely surprised. I was like, just tell me how to prescribe HRT. But you're like, no, Sam. Like,
there's so much more to menopause.
But I'm like, why?
I think that's it, and exactly that. So if you're looking to offer HRT and menopause is becoming more and more people becoming more about menopause. Well, the as Alice says, the Foundation Advanced combination, which we now sell as the Longevity Essentials package, that covers everything you need to know. So even though we sort of do the diet and lifestyle and the hormones, menopause doesn't stop there. Weight is a really big issue in women who are going through menopause. So is brain fog and mental performance optimization, and as is healthy aging. So all of it really comes into feeds into that menopause care. Great. Look, I'm really conscious of time, so I just wanted to try and we do a bit of a rapid fire through these remaining questions. It's great, so do sort of keep them coming in, but we will have to stop at some point. Now, Yasmin asked very quickly, are you, how about insurance if you are a medical practitioner? So quickly, round robin, my insurance costs around £400 a year, and it covers me for everything to do with longevity, and it's very easy to set up. Go on, over to you.
Yeah, mine is probably about 550, but I also do aesthetics and I teach aesthetics as well as menopause and longevity stuff, including menopause. So, but yeah, about 500, 550.
Mine same.
Yep, exactly the same. So that's the same. Doctors, nurses, your ophthalmologists, or whatever your background, I think it's a similar thing. And we have a partner that we partner with who gives a very good rate to the students that come through our courses, so you can get upset with insurance very, very easily. Good. Do we give information on supplements and prescriptions? Again, from Amy. Amy, loving your questions coming in. And yeah, so we do give information on supplements and prescriptions. So in the course that we're doing at the moment, that is more for people who aren't prescribers and for just general people who want to get into longevity coaching and sort of offering advice in longevity space, that is all really focused on supplements. And we go into, like I said, for andropause, all the different supplements that will work on different aspects and symptoms for andropause. However, with our existing courses, that is a combination. It's a bit of a mix of both supplements and also the medications. And I mean, over to you, and I'm a bit anxious asking this live on air, Sam, but did you find that was enough, or was it too much in terms of actually getting the started into longevity and offering these consultations?
It was exactly enough. It was exactly what was needed. I'll be honest with you, when I did the foundation course, you know, I completely whizzed through it, right? But I watched each module, I want to say like 3 times. So that's like hours and hours of me just going, I need to make sure I've got this right. And then the advanced, I mean, I'm still on my second watch because it's a lot, but it's also very specific. Whereas if you were to say do a course uni-wise, you just get given everything. Whereas you're like, no, this is what you need to know.
Yeah, it was very hard to actually what to include.
Yeah, I think it's quite a nice mix, because I feel that there's a lot of science behind what is this supplement or this medication, why are we doing it? But then there's also at the end a summary, and for the people that aren't so, like, I don't know, chemically minded, there's just that this is what it is. And but there's also the why, if you want that, if that's how we learn. Basically, we all learn differently. So I think it covers, as Sam says, it's quite a lot of information, but it's presented in ways that appeal to different learners.
Brilliant. Just scrolling down, and nice to see that Alina has helped answer Rabia's question about aesthetics that I touched upon earlier. So thank you, Alina, for that answer, and hopefully that's helped you, Rabia. Going back to Adam as well, another question: how do you address the lack of a physical examination if your clinic is online only? Now, this is a really good question. I'll put it over to Alice, to you first. So how do you get around that sort of lack of physical examination?
So yeah, that's a really good question, Adam. And I guess, like, I think through history, and this what we do is look. The whole thing about our job is we can see the pathology in your eye and we examine, and that's how we make a lot of our diagnosis. And during COVID, we couldn't see as many patients, and we set up virtual consults. And even in ophthalmology, we did big audits on it all, but we found that 70% of people we could give a diagnosis and a treatment to just through talking to them and through their symptoms and seeing them obviously face to face on a camera. And we were able to give that advice. And that's coming from, as I say, a very physical examining specialty. Yeah. Whereas in longevity, it's a lot more, there's so many factors to it. A lot of it is in the history and really like getting to know. I'm really nosy with my patients. And I say to them at the beginning, I'm going to ask lots of questions, but the more you answer, the more I can really tailor this to you. I want to know what time they get up, what they have for breakfast, what time that is, through to how many times they go to the toilet overnight. Like, I just want to know everything. And through the history, you can really get a really good idea of things. And I think a lot of the time people are coming to you with these symptoms, not necessarily physical pain or in a specific joint or area of their body. It's a slightly different to the traditional medical consultation. But I agree, if you think, for example, someone's displaying, they're tired, they've lost loads of weight, they're feeling anxious, their mood is all over the place, they're not sleeping, and you're thinking, for example, thyroid. Obviously, you can see certain things online, but then you're going to have to start signposting them to go and see their local GP if you're not in their local area, because obviously we have to keep our patients safe at the end of the day. But I think even if you're doing an e-consult, having the video on is, one, it makes it more personable, and two, you can pick up a lot from the history and just seeing somebody over a camera.
Definitely. And I'm just really, again, conscious of time, and I've just got to Andrea's question, which is a really good question that I want to spend just a few minutes on before we finish. And I'm going to probably make that the last question. I'll do a quick answer on the CQC approval. You don't need to have CQC approval to start practicing longevity medicine. There is a whole host of things that you can do, diet, lifestyle, supplement advice, that does not require CQC approval at all. If you want to dive more into that in detail, then you should do our Longevity 101 course, which is the one I'm filming at the moment. That is going to be coming out at the beginning of next year. And that is going to be all about all the things you can do without even needing CQC regulation. I don't want to talk about that, Sam. I'd love to hear your input on this, but I know I'm really conscious of time. So I just want to go back to Andrea's question. Now, this is a really good question. Like, how do you actually sell a longevity program to your patients? So I'm going to open the floor to you guys. So Sam, let's start with you. How do you sell someone onto the idea of longevity? Andrea said here, it's an expensive offering. It's not easy to convince healthy clients to invest in something that doesn't provide a guaranteed result. Whilst we can improve the health and well-being, how long does the treatment actually last? No one really knows. So how can you actually sell that longevity program to your patient?
So I found that within this sort of field of longevity, the people who are coming to you, they want it. That's what they want. So we're not going out going, hey, do you want it? Do you want? No, that we're not selling it. The people who are coming, they want the longevity. All you have to do is sell, I suppose, your knowledge, your support, and what you can do. And especially you kind of have to sell, are you the right person for them? And that's almost a relationship you have to build from having that conversation with them. So I find that I'm not actually selling longevity, but because currently in the current, wave that we're in, longevity is a massive buzzword. I mean, NMN and NAD is just floating all over the place. And I feel like people aren't even doing that appropriately. But if you can just talk about, just pick little aspects of, the longevity pyramid and just talk about how you can optimize that. And so for me, I have picked the hormone and I have picked the weight optimization aspects of longevity. And within that, I am still bringing longevity to them, whether they kind of wanted it or not. They we're going to get it. So yeah, I'm not selling it. They are coming. They will come to you.
How about you, Alice?
Yeah, I sort of agree with Sam. If you build it, they will come. I think it is, obviously there's this term, the worried well. Those sort of people are probably more targeted. But as Sam's saying, it's not about targeting people, because you wouldn't necessarily go out and tell someone that they need to have Botox and you're going to give that to them. Like you wouldn't tell someone that they need to eat this diet or they need to sort out their hormones or something. I think it is just based on, I think the best way, and we were talking about how to acquire clients earlier, it's word of mouth and friends and family. Someone finds out about you, and I appreciate at the beginning that can be a bit tricky. But when you're starting out, friends and family, you'll have someone that you know, in your family even, that you want to help, that you can, or there's a family history of a certain disease and you see people worrying about that, and you just sort of, that's your way in for the discussion, as Sam was saying. You just got to have that talk.
I've had a lot of family members be referred to me after consults with me, and I think that's the key thing is all three of us have found it really easy to expand and grow this through word of mouth, because there isn't much out there like this. It's you've not really got a lot of competition, and people hear about you, they hear that you offer it. And Andrea's asked a quick follow-up question here about the target market being too small. Well, I disagree. I mean, how many people are overweight or obese who need treatments for weight optimization? How many people out there are going through menopause? How many people are going out there through andropause? It's a crazy, huge market. It's just that people don't know about it. And once, as I say, word of mouth is so important to getting the word out there. And people just hear about it and they're like, what? I can do what for my menopause? But I thought HRT gave you breast cancer and blood clots. Oh, no. Not if it's done right. It's completely transformative. And the answer is you prioritize those quick wins. It's really all about getting your sleep optimized, getting those hormones optimized. So although they're not going to be seeing the results for 30, 40 years for their longevity, they're actually immediate improvements in their health and their well-being and their energy levels and their sleep quality is really noticeable. That we've had maybe a very, very small number of patients who have dropped off our follow-up programs. Within a month or two, they're straight back because they know how rubbish they are without that supplement regime, without that diet and lifestyle and that support. So they really, once they go into it, they really, really get into it. And I'm glad that Tishana is on here agreeing with us. There's a huge market and interest in learning more. Thank you, Tishana. It is so many people. It's almost anyone getting older. I'm just looking through any last questions. There's a whole other section of Q&A here, and we've got another 12, 14 questions on here, which is really, really hard. So I'm just going to pick through and look at some very, very last few ones. And one's just come through on as well. Lovely. So it's really good to see so much interest here. And I guess the real issue we have is we haven't got enough time to answer all of these questions. So there is, I mean, just very, very quick fire. I think I'm now just going to take, because we've finished out of time, guys, I'm just going to quickly go through and answer the ones I can see here as quick as I can. So let's go. Right. Do your course certifications ever expire? No, they do not. The target is unfortunately too small. We've done that one, Andrea. And Tishana, thank you very much. Alina, do you offer mentorship support after sign up for the course? Yes, absolutely. We have a longevity clinician package. Now, this package is incredible. This offers everything you need to get started and in longevity medicine. It includes our foundation and the advanced e-learning training, covering all of these topics that we've talked about. But it also covers the business booster course, which is a one full day just on how to get patients into your clinic, how to support them, how to develop that service through either the funnel, the sales funnel, but also into that ongoing support and ongoing mentorships and memberships for those patients. It also includes 3 months of Apex Plus, which is including longevity dinners, but also CQC practicing privileges if you do want to start offering prescriptions. So that is the Rolls Royce of packages that we offer at Apex Medical. So you can look into that, called the longevity clinician package, and a really, really interesting offer that we've put out there now. There is anything else on this side? No. And I'm just going to go through and looking into the Q&A section. Tips about exposure when launching an online-only longevity medicine clinic is just getting your word out there. So just putting out sort of webinars, putting out free content, putting out educational content. It's all about the leads. We cover a lot of this in the Business Booster course. But it's all about creating that really wide funnel at the top so people can really raise awareness, because we're all pioneers in longevity medicine. We're the ones that are actually creating this whole new field and this whole new approach to medicine that in 10 years' time is going to be just as big as aesthetics is. So we are creating we're informing people right now about what longevity medicine is. So it's about putting out education content, educating people about what people can do, what they can do about their hormones, what they can do about optimizing their health and their weight. Going through quickly, lovely to hear you, Sam. Longevity. Sam and Alice, there's some lovely questions here, Sam and Alice. I'm going to forward on to you with the names of the people who have put these in, and I'm going to ask you to get back to them offline. So some specific questions about ophthalmology and about you too, Sam. So I'll forward those on to you, and we'll get back to you guys directly who have put those questions in. Do you have to be a HRT specialist to prescribe HRT or testosterone? No, you do not. Any doctor, dentist, nurse, physiotherapist. I know we had a question come in before the course about physiotherapists. Can they prescribe? They absolutely can. If they're a prescribing physiotherapist, they can prescribe HRT because that has been shown to improve the outcomes they will have with physiotherapy. We've actually spoken to the Chartered Society of Physiotherapists about this and have their support. But obviously more about the right supplements. Well, join our course. Lots of information about the right supplements. Is the course equivalent to a diploma? No, we have a longevity fellowship coming out next year. That's going to cover every single one of our courses, masterclasses, and that's going to be more of a diploma type level. Name of the insurance company. So I am with Lockton's. Guys, who are you with insurance wise?
Within Singh.
Perfect. Price of the course, so $899 for the longevity. So the longevity essentials package, which is just the e-learning only. Longevity clinician package is $2,999, and that includes everything, includes all those live training days as well. So good to be able to rewatch the modules. Yes, it is, Anna Marie. Thank you very much, and I loved your feedback on them. It was very, very kind words you said. And yeah, the modules are there for you to rewatch. We're not taking them away from you. We want you to actually get out there and practice this. And it's the same with the ongoing support through the community. You know, we are here to help you get into this practice. And Sam's obviously a big advocate that you were there as a receiver of the information on the community, and you're now very much there supporting other people as they go through it too. And finally, I'm a GP interested in doing a course and an online course. Yes, you can do the online version. It's longevity essentials. You train aesthetics as well. You have insurance from cosmetic insure. Yes, they can add that on. It's only about 30 or 50 pounds. They don't even charge that much. Good. I think that is all the questions that I've answered on the chat here live. Can I sign up for longevity course before having GMC? You're a GP. Yes, you can do the longevity course before having GMC. But we just ask you to, when you're attending the live training day with consulting real patients, you have your GMC in place there. You can do the online training, which is the longevity essentials package. Absolutely right. Good. There's a lot of questions that have been put in before the webinar we haven't even had time to touch on, but I just wanted to take a moment to really thank both of our guest speakers. So Sam, it's been a real pleasure, honestly, working with you the last few months, seeing your clinic grow, seeing you starting to offer these practices. It proves to us at Apex Medical, you know, it shows how well it is, and the number of people that you're supporting coming through that journey and doing their own clinics. You know, you're just the first one, and there's so many other people now that are coming through and setting up their clinics, just even the last few months of training. Alice, thank you again so much for taking time out of your evening to join us. It's been a real pleasure to hear both of your insights in setting up and launching a clinic. Guys, hopefully this has been really informative to you. I appreciate that was a real whirlwind of about 100 questions in the last few minutes, but any more questions you've got the email address that's been dropped into the chat. You'd also get a recording of this to watch back as well. But just please rest assured that one final thought from me is that we aren't here just to give you a course and leave you alone with the wolves. You are very much here to become a community, the new community that is taking longevity medicine, taking medicine as a whole forwards. Having been to global conferences and presented at global conferences, I've seen that this is the way that the world is going. And the UK really have a great opportunity to expand into the private sector, be it through aesthetics clinics, private GP clinics, whatever it might be. But it's a really good opportunity to improve the health of the nation as a whole. So thank you all for your time this evening. And it's really lovely to see you. Sam, Alice, thank you so much again. Bye-bye.
Bye.